All right, Mike says the growth in cases could also be largely explained by changes in behavior. Masks are off and the mandates are over.
Oh, that's definitely not what's going on. No, I just say that tongue in cheek. That's certainly what's going on. And when people talk about, oh, the virus is more transmissible, how much of that is that because we're helping it? We're all, we're all gathered inside. We don't have masks. We're excited to be together. I think people are chattier than they have ever been. Even the introverts are starting up conversations. We're doing everything we can. So behavior is huge in this pandemic.
All right, Mary says, I'm not a scientist, a doctor, a statistician, merely a vaxxed and double boosted individual who has never stopped wearing masks when indoors in public spaces. So my questions are these. How scared should I be and for how long?
Well, I don't think you should be scared. I think that's the big thing is as we've gone through, if you're a younger individual and you're up to date with your vaccines and you've done a really good job of addressing your health issues, you're at very low risk. If you're an older individual, start to have health problems, we're recommending those 4 shots. The immunocompromised, we're even recommending Evusheld, which is a passive antibody on top of that. We also want everyone to have an action plan. If you're a high-risk individual and you test positive, time matters. You jump in, you don't wait and see. Another 90% reduction in a bad outcome. So I think that if we really are hitting on all cylinders here, people don't need to be scared anymore.
All right, Dawn says, I'm not a doctor, just my opinion, but I feel now that so many people have had COVID and have recovered. The threat, the dread of getting the virus has waned to the point where the populace needs to be scared again. Thus, this warning basically targeting people who have already experienced the virus.
Yeah. I mean, I think there's a couple things there. One are people are kind of done talking about the virus, but we still see those things on the highway, click it or a ticket. Just, we don't have to keep being obsessed and be focused on the virus, but we should do all the things that keep us safe, get those vaccines, be ready for early treatment. But do realize that the virus is out there. There's more virus now than there's ever been. Act accordingly.